We're in the waiting room of a free clinic that helps the refugee community outside of Denver. During the public health emergency, people were locked in. If they had Medicaid coverage, they couldn't lose it no matter what. That has now changed with the end of the emergency. So we're talking to the doctor who runs this facility about some of the concerns he has going forward.
The Mango House may not sound like a doctor's office, but Dr. PJ Parmar says that's the point.
It's tasty and it's fun. It's not the Center for Refugee Healthcare, something that sounds demeaning. It's a place that people want to be proud to go to.
Many of his patients are immigrants and refugees.
We get a lot of people with chronic pains. They hold their mental health in their body, back pain, chest pain, headaches, and so forth, because they come from war zones and places where they were at. There was an oppressing population, so they come here and they're always on guard.
He'll treat those without insurance for free. He also accepts Medicaid, which not all doctors do since it typically pays less per visit than private insurance. People like Rostam Shinwari.
Stand here.
His family of 7 escaped Afghanistan in 2021 after the U.S. withdrawal.
What's your name? They got a family of 7 with one working parent who's probably, unfortunately, not working at a great job. They're probably not going to be at risk of losing the Medicaid.
Their coverage may be safe. In Colorado, a family of 7 would have to make more than roughly $60,000 a year to no longer qualify.
The biggest factor is somebody's income changes and puts them beyond the threshold for Medicaid.
Adam Fox is a nonpartisan health policy expert in Colorado. He says changes in how much money a family made during the pandemic will be a big reason many lose coverage. While Colorado is just beginning to go through its rolls, a handful of states started the process as soon as Congress would let them on April 1st, like Arkansas. This week, the state released what it's done so far. More than 72,000 people were removed from Arkansas's Medicaid program. More than 5,000 people were removed because their income exceeded the limit for their household. But more than half were removed for issues like not turning in their paperwork. Fox told me he worries about whether re-enrollment packets, which several states are sending through the U.S. mail, will get to those who need them.
Which does present some challenges because if somebody has moved or their address has changed for one reason or another, it can mean they're not receiving that notification.
Fox says many people who lose coverage will qualify for special tax credits to make Affordable Care Act plans, known as Obamacare, more cost-friendly. Another state that already started evaluating who qualifies for Medicaid in April was West Virginia. Kathy Brown leads a free clinic in Wheeling. In March, she treated roughly 1,200 patients. But in April, as people started to lose Medicaid coverage, the number went up to roughly 1,500. 300 more patients means an increased cost to operate her clinic.
Our numbers are already, we've only finished 1 month. Now we have to figure out how we're going to provide them with the labs, the testing, the x-rays, surgery, whatever they might need, because they will no longer have access to their medical card.
Dr. Parmar says people need to realize that many of his Medicaid patients have jobs and private insurance, but deductibles and copays often make care too expensive. He worries about where his patients who lose Medicaid will go for specialty issues when they need care beyond what he can offer as a family doctor.
When we can't figure it out, we refer out for specialists. And even if I'm willing to take Medicaid and see some people even for free, the specialists generally may not be.
He says many issues that might need surgery can often go untreated. And as an emergency order may be ending, issues he sees for those new to this country when it comes to healthcare are far from over.
Where they came from, whether those are war zones or the journey to get here, and that's one thing, but as soon as they get here, their second phase of their life starts, and that can be as traumatic as the first.
There are still many unanswered questions about COVID-19, and one of the main ones is, still after all this time, where exactly did it come from? We'll take a look at the debate next on The Race.